So our first commitment is going to be from Nat Sims, who's going to introduce his organizational commitment, and then we're going to go to Chris Jarrett.
So, good afternoon again. I've got two hats and two commitments. The first one is a foundational commitment that had existed in the Partners healthcare system really since 2004. And we present it for several purposes as a foundational commitment, as an example of how to write a very smart, achievable aims statement, and also as a foundation for the second commitment, which is a specific commitment from Bill Churchill, the pharmacy director at the Brigham and Women's, who couldn't be here today, with respect to what happens in the IV room. So I guess I have the clicker, and I'll push it forward. As I think everybody knows, Partners Healthcare is in the Boston area, comprises two founding hospitals, the Brigham and the MGH, and approximately 9 other hospitals, many physician practices, and comprises assets of sort of in the $9 to $10 billion size. In October of 2004, Jim Mongan famously laid out what he first called signature initiatives, but later were renamed high-performance medicine. The foundational element, number one, which perhaps we should number 0, was to pervade the place with new information technology. And on the topic of interoperability, everything that was designed was with services-oriented architecture so that all data elements could be accessed and all information by any application. And therefore, under that and with that premise, number one was to increase patient safety with a goal of 0 errors. And the other goals related to clinical practice and responsible use of particularly radiology resources. But what Jim said was that rather than attack all errors or all preventable deaths, we're going to focus on just one thing, medication safety, on the premise that if we can't do medication safety well or even perfectly, we can't do anything. And if we can do medication safety well or perfectly, we can achieve anything. And so the patient safety roadmap in Partners Healthcare was part of a family of priorities. I have captured from a public, from the website of Partners in 2005, a direct screen capture, the exact wording, which I present for your consideration, and hopefully the camera will capture what's on the slide so it's in the video. It was worded very carefully. I won't go through it word by word, but it simply said, and it was in 2005, by 2010, Partners hospitals will have fully integrated clinical systems to minimize medication errors, ... to 0. And the elements were computerized order entry with decision support, med reconciliation on the second slide, and the full array of barcode med administration, the barcoding of medications, patients, and caregivers, and an EMR system, particularly that developed at the Brigham, that was fully integrated with the pharmacy information system. And then the one thing that we did not achieve in 2010, which was that the pumps automatically documented into the EMR what they were doing. I put that forward to you as perhaps a useful example of a smart aims statement that was achievable and yet very elevated. Remember, this is 2004 when it was written. The way Partners reported the results was basically to measure the progress of implementation of these elements at all 9 hospitals, and we met our objectives, our pay-for-performance objectives. In fact, we were able to gain concessions with respect to managed care contracting withhold relief by promising to do these things and then doing them. From a measurement perspective, I cite the wonderful article in the New England Journal of Medicine by David Bates and co-authors, including Bill Churchill, in which they report the effect of barcoding technology on the safety of medication administration. And I searched forward using Science Citation Index and found that all articles written since there are pretty consistent with the conclusion that just the BCMA, barcode med administration, reduces med errors by about 50%, and the malpractice claims have gone apparently to essentially zero. And obviously this is just a tiny peep into a giant, giant project, but that is the foundational commitment from Partners Healthcare starting in 2005, completed by 2010, and rigorously researched. So now take the Partners hat off and change to the Brigham and Women's hat and go on to a commitment that we'll look forward to Chris Jerry's comment on.